Dear viewers, recently I discussed driving pressure, transpulmonary pressure and plateau pressure during invasive mechanical ventilation. In this video I am going to discuss peak pressure, how this pressure parameter is useful during invasive mechanical ventilation and what it entails. I am Dr. Sunil Garg from Essentials of Acute Care. Peak pressure is the total and the maximum pressure generated by the ventilator to overcome airway resistance and alveolar resistance to attain peak inspiratory flow and to deliver desired tidal volume. Put simply, it is the amount of airway pressure delivered by the ventilator to initially overcome the resistance of the endotracheal tube, airway and the alveoli. It is graphed as a summation of both initial airway resistance and lung compliance. In general, an acceptable maximum peak is 40 cm of water. How we calculate or measure it? Peak pressure may be calculated by adding plateau pressure to the product of airway resistance. Peak inspiratory pressure is displayed on most ventilators. Here I mentioned various formulas to understand it better. What determines peak pressure is resistance of airway or ventilatory circuit including endotracheal tube, compliance of respiratory system including lung and the chest wall, tidal volume, PEEP, inspiratory flow rate and inspiratory flow pattern. Any change in these values affects peak airway pressure. There are various causes which leads to increase in peak airway pressure without any change in plateau pressure, as lung compliance is not affected in such patients, and these include bronchospasm or laryngospasm, mucus plugging or retained secretion in airways, water in circuit, tube kinking or biting, small size of endotracheal tube, ventilator scrutiny as patient is fighting, high tidal volume or either high flow rate or square wave flow pattern on volume control. Any condition which increases plateau pressure will increase peak pressure, as peak pressure is summation of plateau pressure and airway resistance. Condition which increases plateau pressure and peak pressure both includes any condition which affects pulmonary or chest wall compliance like pneumonia, pulmonary edema, ARDS, autopeep, pneumothorax, pleural effusion, atelectasis, abdominal compartment syndrome, and obesity. It is unknown whether there is a specific peak pressure limit that is safe. A maximum acceptable peak airway pressure of less than 35 to 40 cm of water is widely used. Thanks for watching this video. Please do not forget to subscribe to this channel. If you have any feedback, suggestion or comments, please write down in the comment section box. See you in my next video on some interesting topic. Till then, bye and take care.